Hi, I'm Francois Charest from Concerto, and I'm here today to talk to you about some of our recent work on slow progression in NSCLC patients. This is joint effort by some of Concerto's medical doctors, data scientists, and machine learning engineers. Extreme tumor progressions have drawn a high level of scientific interest in the last years. A rapid tumor growth phenomenon referred to as hyperprogression has been observed on patients progressing within the first months following initiation of an immunotherapy treatment. At the opposite end of the spectrum, some exceptional responders have unusually long responses. While little is known about the biological mechanisms behind extreme treatment response, the current literature suggests a small, non-consensual set of clinical features as potential predictors. Large-scale real-world data sources and approaches may become crucial in establishing further evidence. This work is part of a series of publications aimed at characterizing extreme progressors and comparing the faster progressors to slower ones. Here we are predicting what we call slow progression, a proxy for a class of patients called exceptional responders, defined by the National Cancer Institute's Exceptional Responders Initiatives as including only patients who had a complete or partial response lasting at least 6 months. The benefits of such a model, among others, are raising hypotheses for more targeted research or studies, suggesting better clinical trial selection, and on the longer term, one can imagine such a model as part of a clinical decision support tool. We use Concerto's real-world dataset based on clinical oncology data from CancerLinQ discovery linked to claims data, as well as progression assessments extracted by Concerto's curators. We use advanced NSCLC patients receiving any second-line therapy. The outcome we measure is essentially progression-free survival, but if we censor if the patient did not have response data within 180 days from their prior assessment. As a disclaimer here, we are not using a strict definition of exceptional responder, but a less stringent definition. As the index date, we use second-line therapy start date. The model considers data up to 120 days prior to that index date for most data features. This is based on a small optimization routine of that parameter. The clinical features here were extracted using Concerto's code library on those real-world data sets. And as a disclaimer, lines of therapy and regimens are defined by Concerto's rule-based algorithms and are dependent on completeness of treatment documentation, as are in general any clinical predictive feature we process from electronic health records. We trained an XGBoost classifier on 80% of the patients satisfying the selection criteria and evaluated the chosen model's performance on the remaining 20%. For model interpretation, we use Shapley additive explanations, or SHAP. This provides a decomposition of each patient's score. Here it's the probability for a patient to be a slow progressor into contributions coming from each predictive feature. The results. 2,200 patients met selection criteria, from which 420 were slow progressors. That's about 19%. We note that a data set of this size may help in getting more robust estimation, as the analysis found in the literature typically involved at most a few hundred patients. We observe that the performance we get from our XGBoost classifier model and AUC ROC of about 0.75 compared favorably to that of a traditional logistic regression model. This also aligns with the most comparable modeling performances we are aware of. We also calculated the effect of each clinical feature on our model scores and noticed that the model is leveraging a variety of feature categories. For example, lab values and vitals that were pre-processed from the raw form in EHR. Seeing them as good predictors here is good news, since they are widely available and inexpensive. It is also sometimes noted in the literature that prior response history may be related to future treatment response. Our dataset gives us an opportunity to quantify that. The regimen information, such as number of regimens, length, time gaps between regimens, seem to also play a major role, hence the importance of having them in a readily usable standardized form. In summary, we demonstrated that we can leverage Concerto's curated progression data for modeling extreme progression behaviors. We showed that characterization of slow progression can be improved using machine learning and interpretation approaches. The predictive modeling and unsupervised analysis done throughout identified a substantial list of factors that may be predictive of slow progression, more comprehensive than the ones seen in the literature. Some of the future directions we want to take are studying fast progression phenomena, studying other cancer types, specific treatments, or different treatment lines. Thank you for your attention and your interest.